I want you to do something right now. Before I say another word, I want you to look down at your feet. Not in a moment, right now. Look at them. Because what I am about to tell you in the next 20 minutes may be the most important thing you hear this year. And I say that not to alarm you, not to frighten you into watching, but because in my years of clinical practice, I have seen the same story play out hundreds of times. A patient comes in. They have had diabetes for years, sometimes 5 years, sometimes 10, and they never knew. They felt reasonably fine. Their energy was manageable, but their feet were telling the story the entire time. Every single sign was there, written clearly on the skin and nerves and circulation of their feet, and nobody had ever told them how to read it. My name is Dr. Sam Aric, and today I am going to teach you how to read it. I am going to walk you through 8 specific signs that your feet may be showing you right now. Signs that doctors, including myself, recognize as early and sometimes not so early indicators that diabetes is already present and already progressing in your body. Some of these signs you may have noticed and dismissed as normal aging. Some of them you may not have looked for at all. And one of them, sign number 4, is something that the vast majority of seniors completely overlook, even those who are already being monitored for blood sugar issues. So I need you to stay with me through this entire video, because missing number 4 specifically could mean missing the single most important warning your body is currently sending you. Before I get into the 8 signs, I need to spend just a few minutes explaining why the feet of all places on the human body are often the first place where diabetes makes itself known. Because once you understand this, the signs themselves will make complete sense. Diabetes, at its core, is a disease of blood sugar dysregulation. When blood glucose levels are chronically elevated, whether due to type 2 diabetes, prediabetes, or insulin resistance, 2 systems in the body take the earliest and most significant damage. The first is the vascular system, the network of blood vessels, particularly the small ones, the capillaries and arterioles, that supply oxygen and nutrients to tissues throughout the body. The second is the peripheral nervous system, the nerves that run from the spinal cord all the way out to the extremities, including the legs and feet. And where do these 2 systems converge? In the most vulnerable, most exposed, most mechanically stressed location in the entire human body, the feet. The feet are, quite literally, the furthest point from the heart. They receive the least robust blood supply. Their nerves are the longest peripheral nerves in the body, which makes them the most susceptible to damage from elevated glucose. And they bear the weight and mechanical stress of every step you take, every day of your life. This is why, in my practice and in practices of physicians around the world, the feet are one of the first places we look when we suspect diabetes or want to assess how well it is being managed. Now, I am going to take you through all 8 signs one by one in detail, because I want you to not just recognize these signs, but understand exactly why they appear, what they tell us about what is happening inside the body, and what you should do the moment you identify any one of them on your own feet or on the feet of someone you love. Sign number 1 is numbness, or a persistent tingling sensation in the feet or toes, what many people describe as a feeling of pins and needles that does not go away, or a dull, constant numbness that makes the feet feel as though they belong to someone else. This is one of the earliest manifestations of diabetic peripheral neuropathy, nerve damage caused by prolonged exposure to elevated blood glucose levels. When blood sugar is chronically high, glucose molecules attach to the proteins that form the myelin sheath, the protective coating surrounding nerve fibers, in a process called glycation. This damages the myelin, disrupts the nerve's ability to transmit signals efficiently, and over time causes the nerve to malfunction and eventually die. The longest nerves in the body, the ones running to the feet, are affected first, which is why this tingling and numbness begins in the toes and works its way upward toward the ankles and lower legs. Many seniors dismiss this sensation as poor circulation, cold feet, or simply a consequence of aging. And while those things can also cause similar sensations, persistent tingling or numbness that is present most days, that does not resolve with movement or warming, and that seems to be gradually worsening over time, that is a nerve telling you something is very wrong. Do not dismiss it. Sign number 2 is a burning or shooting pain in the feet, particularly at night. This might seem contradictory to sign 1. How can feet that are numb also be painful? But this is actually one of the most clinically important paradoxes of diabetic neuropathy, and it is something I explain to my patients regularly. In the early stages of nerve damage, before the nerve is fully destroyed, it becomes hyperactive and misfires, sending pain signals to the brain, even in the absence of any actual injury or stimulus. This produces a burning, electric, sometimes stabbing pain that tends to be worst at night when there are no other sensory distractions competing for the brain's attention. Patients frequently describe it as feeling like their feet are on fire while lying in bed, or like electric shocks shooting through their toes. This nighttime foot burning is one of the most specific early signs of diabetic neuropathy I see in clinical practice. And if you have been experiencing it even occasionally, it deserves immediate medical attention and blood sugar testing. Sign number 3 is changes in the skin of the feet, specifically skin that has become unusually dry, cracked, peeling, or noticeably thickened on the heels and balls of the feet. The skin of the feet is regulated in part by the small sweat glands embedded within it, and these glands are controlled by the autonomic nerves, the branch of the nervous system that governs involuntary body functions. When diabetic neuropathy damages these autonomic nerves, the sweat glands in the feet stop functioning properly. The result is skin that loses its natural moisture, becomes dry and fragile, and develops deep cracks, particularly along the heels, that can become painful, bleed, and in more advanced stages of diabetes become entry points for serious infections. If you have been treating your feet with moisturizer for dry, cracked heels and finding that the dryness keeps returning despite consistent treatment, this is not simply a skin problem. This is your autonomic nervous system telling you that something deeper is wrong. Sign number 4, and I told you to stay for this one, is a change in the shape of the foot itself. Specifically, the development of what is called a charcot foot, or more subtly in earlier stages, an unexplained change in the arch of the foot, a collapse of the midfoot, or toes that are beginning to curl or hammer without any clear orthopedic cause. Charcot neuroarthropathy is a condition that occurs when neuropathy is severe enough that the patient loses the protective sensation in their feet, the normal pain and pressure feedback that prevents us from walking in ways that damage our joints. Without this protective sensation, the bones and joints of the foot are subjected to repeated undetected microtrauma with every step. Over time, this causes the bones to fracture, the joints to dislocate, and the foot to collapse into an abnormal shape, sometimes dramatically, sometimes subtly. The reason most seniors miss this sign is that because the neuropathy has already removed the pain sensation, the foot may not hurt despite undergoing serious structural damage. A foot that is changing shape, becoming flatter, wider, developing a prominent midfoot bulge, or showing curling toes that were not there before, in a person over 60 is a medical emergency that requires immediate evaluation. This is the sign I see missed most consistently, most tragically, and most unnecessarily. Please look at the shape of your feet today. Sign number 5 is slow healing wounds, cuts or sores on the feet, particularly any wound that has been present for more than 2 weeks without showing clear signs of healing and closure. In people without diabetes, minor cuts and abrasions on the feet heal within days. The immune system responds, new blood vessels form to supply the healing tissue, and the wound closes. In people with uncontrolled or undiagnosed diabetes, this process is profoundly impaired. Elevated blood glucose damages the white blood cells responsible for fighting infection, reduces the formation of new blood vessels needed for healing, and thickens the blood in ways that reduce circulation to peripheral tissues. The result is wounds that simply do not heal, that sit open on the foot for weeks, sometimes months, becoming deeper, wider, and increasingly infected. In my practice, a non-healing foot wound is treated as diabetes until proven otherwise. If you have a cut, blister, or sore on your foot that has been there for more than 2 weeks and does not seem to be closing, please do not wait. See a doctor today. Sign number 6 is swelling of the feet and ankles, particularly swelling that is present when you wake up in the morning, or swelling that is consistently worse in one foot than the other. While foot and ankle swelling has multiple causes, including heart disease, venous insufficiency, and medication side effects, persistent swelling in the feet of a senior over 60 that is not explained by a known condition deserves blood sugar evaluation as part of the workup. Diabetes damages the kidneys, a condition called diabetic nephropathy, and as kidney function declines, the kidneys become less able to regulate fluid balance, leading to fluid accumulation in the legs and feet. Additionally, the vascular damage caused by diabetes impairs the ability of small veins to return fluid from the feet back toward the heart efficiently. If your feet and ankles are consistently swollen, particularly if this swelling is accompanied by any of the other signs I have described, this combination is a serious signal that requires medical evaluation without delay. Sign number 7 is a change in foot temperature, specifically one foot that is consistently colder than the other, or feet that are noticeably and persistently colder than the rest of the body, even in warm environments. Diabetes causes peripheral arterial disease, a narrowing and hardening of the arteries that supply blood to the legs and feet in a significant proportion of people who have had elevated blood sugar for several years. When blood flow to the feet is reduced due to arterial narrowing, the tissues of the foot receive less warm, oxygenated blood, and the foot becomes cold. One foot being significantly colder than the other is particularly significant because it suggests that the arterial blockage may be asymmetric, affecting one side more than the other, which is a pattern seen in peripheral arterial disease. If your feet are persistently cold despite warm socks, warm rooms, and warm weather, and particularly if one foot is colder than the other, this requires a vascular assessment and blood sugar testing as a priority. Sign number 8 is the appearance of dark, velvety patches of skin, typically found on the ankles, the sides of the feet, or between the toes, that were not there before and that do not wash off. This condition is called acanthosis nigricans when it appears in body folds, but a similar darkening of the skin can appear on the feet in people with significant insulin resistance and elevated insulin levels. This skin darkening is caused by insulin stimulating the receptors in skin cells, causing them to proliferate abnormally and produce excess pigment. It is one of the most direct visible markers of insulin resistance, the metabolic state that precedes and underlies type 2 diabetes in the vast majority of cases. Many seniors notice these dark patches and assume they are age spots or bruising. They are neither. Dark, velvety, unexplained skin darkening on the feet or ankles of a person over 60 is a metabolic warning sign that should be shown to a doctor immediately. Now, I want to speak to you directly as Dr. Sam Aric, not just as a physician delivering information, but as someone who has sat across from too many patients who came to me too late. If you recognized one or more of these signs in your own feet while watching this video, I need you to hear this clearly. This is not the time for watching and waiting. This is not the time for telling yourself it is probably nothing. The signs I have described today are not subtle inconveniences. They are your body's way of communicating, in the only language it has, that something serious is happening inside and that it needs help now, not in 6 months when your next routine checkup comes around. What I want you to do, starting today, is this. First, examine both of your feet completely, top, bottom, between every toe, around the heel, along the ankle. Look for any of the 8 signs I described. If you find even one, numbness, burning pain, dry cracking skin, shape changes, a slow healing wound, swelling, cold temperature difference, or dark skin patches, make a doctor's appointment this week. Not this month, this week. Second, ask your doctor for a fasting blood glucose test and a HbA1c test. The HbA1c glycated hemoglobin gives a picture of your average blood sugar over the past 3 months and is far more informative than a single fasting glucose reading. These 2 tests together will tell you and your doctor exactly where your blood sugar stands. Third, if you have already been diagnosed with prediabetes or type 2 diabetes and you have not had a foot examination by your doctor in the past 12 months, request one at your next appointment. Diabetic foot examinations are a standard part of diabetes care, but they are sometimes skipped in busy clinical settings, and you have every right to ask for one. Your feet have been carrying you through your entire life. Every step, every morning, every errand, every moment of movement. They deserve your attention, and they are asking for it right now through the 8 signs I have described today. Please listen to them. I am Dr. Sam Aric. Share this video with someone over 60 who you love, because one of these 8 signs may already be present on their feet, and they may not know what it means. That share could genuinely change the course of their health, and I will see you in the next video.